But we were, had a baby born. Life was great. Started that business we kind of wanted to start for a long time. Kind of felt like life is just perfect right now. I got my baby, got my wife, got the job we've been hoping for, and we got about 4 days into it. As soon as the last student walked out the door, I kind of just collapsed to the floor.
I called 911, the paramedics came. I was thinking, man, this might be stroke or maybe meningitis, seizure type of thing. And I still was not thinking brain tumor.
I first met Ryan in the ER, actually. He came in with a seizure for the first time ever in his life. And the ER physicians worked him up. We got some images of his head, and it turned out that he had a brain tumor.
And the type of brain tumor it was, the neurosurgeon, Dr. Jeswani, told us that the treatment was first surgery and then chemo and radiation.
Never a good time to wake up and find out you have cancer, but when you got 2 little ones at home, that hit really hard. It's kind of hard thinking that those kids may not even remember you at that point.
This tumor was located on the right-hand side. That was a little problematic because he's left-handed. And so it's often the case that in left-handed patients, their speech centers are located in the right side of the brain. Well, one way that we can do this is to do this surgery while he's awake and try to go through those parts of the brain that don't seem to have any association with his speech.
I do remember some of the surgery. I'm sure I'm missing bits and pieces of it. I remember talking with one of the doctors for a long time. Yeah, it was just a very strange experience, just being kind of nose to nose with this other gentleman for a couple of hours. It's a special bond we now have together. And, yeah.
The prognosis is very good. So after the tumor removal, we got an MRI. The MRI showed complete removal of the tumor. And so I got to learn a lot about Ryan during that brain tumor surgery. It's as if, as I'm taking out a tumor, I made a friend.
For patients like Ryan, we would not have been able to treat Ryan previously. Before we started on this journey, we were seeing a lot of basic neurosurgery, a lot of basic care, and we would have to transfer patients out, or patients would seek care in other parts of the state or the country. And now we're able to really attract people like Dr. Jeswani, who then can perform these surgeries where we hadn't had it before. And we know our community needs it. We know that a lot of patients that need these really advanced procedures have to seek it elsewhere. And what we're saying is they no longer have to do that.
You never thought you'd appreciate a conversation that much. So when you wake up and you can't have one, you can't just say something as simple as "I love you" to your wife or to your kids, and just being able to say, "Amy, I love you," was a really good feeling at that moment.